Hi, this is Robert Keller coming to you from Pure Motion Fitness. Wanted to share some more thoughts with you on one exercise in particular today, but it's one that I consider essential to any exercise program at any age, any ability level. This is one that I've used with athletes interested in performing at a higher level, as well as more fragile older adults who actually have to rely on some sort of an assistive device, a walker or a cane perhaps. But the exercise is called the single leg Romanian deadlift. And there are four main benefits from this exercise that include strengthening the hamstrings, improving glute strength in the glute medius, as well as glute maximus. And it also helps in strengthening the glute medius knee stability. It also gets us moving in the hip, which is what we really want to focus on versus moving in the back. So when we talk about hip hinging, that implies that the hip is the point of rotation and there's no other movement anywhere else in the body. So if you picture a hinge, you have the pin around which movement occurs. In this case, the pin would pass through my hips, but then my upper body and my lower body remain in fixed position. So again, the potential exists with this exercise to promote movement at the hip, not in the lower back where we want to have stability. It also helps improve single leg balance. And I found this to be significant in terms of working with older adults. I'm sure you've seen or know of someone who has begun to shuffle more as they walk. And that's a function of losing comfort with single leg balance. And so it's an attempt to keep both feet in contact with the ground for as long as possible versus taking a normal stride, heel-toe stride. So improving single leg balance is significant with this exercise. I mentioned stabilizing the knee, and this is a role that the glute medius plays. There's been significant research on what's called knee valgus, which is a tendency for the knees to collapse towards each other. That's significant in terms of potential injury to the anterior cruciate ligament or the ACL. We see this especially with ladies in jumping sports where their landing mechanics, as a function of having a weakened glute medius, allows the knees to move towards each other. And so again, through strengthening the glute medius, specifically the posterior fibers. So from a side view, the glute medius would be right about here on the hip. The anterior fibers move this way, posterior fibers this way. It's these posterior fibers that we're concerned with because they abduct the hip as well as externally rotate the thigh. So in performing the single leg RDL, there are some progressions that I'll share with you. As I mentioned, with older adults, I've had them even use their walker for the purpose of performing this exercise. But the key to it is this hip hinging, as well as leveling of the hips. Now, on occasion, I'll see someone performing this exercise in the gym, but I rarely, if ever, see it done correctly or as well as it could be done. So if I'm standing to my side and I have the dowel here in my opposite hand, this would be considered to be the most stable, or I guess the easiest way of performing this exercise. I'm standing on the opposite foot with a slight bend in the knee. And again, the rotation is around the hip. So what I want to do is hinge forward, lifting the opposite leg, coming forward to where I feel a stretch through the hamstring area, and then returning to that upright position. From a front view, what I often see, and this can be an indicator of that glute medius being weak or perhaps being dominant in the hip flexor area, is a tendency to pitch to the side in hinging forward. If I'm putting my fingertips on the hip bone here, that ASIS, as it's referred to, the anterior superior iliac spine, it's this bony point right here on both sides. When I hinge forward, my hips should remain level, not pitched to the side. So those are the key elements to the single leg Romanian deadlift. The first level of progression for someone who is capable of doing so, again, with older adults, I'll even set up a bench set at an incline so that they have something very stable to hold on to, the back of a chair, even their walker positioned in front of them. They may not be able to move through a very full range of motion, but at least we're getting them into single leg balance and getting them moving around that hip joint to begin to strengthen that area. For someone who's apparently healthy, has reasonable balance, but still needs some assist, the first progression would be to place the dowel on the contralateral side, or the opposite side of the stance leg, as I demonstrated a moment ago, and hinging forward from a side view. Slight bend in the knee, but all the movement occurs at the hip. There's no rounding of the back. The next level of progression would be ipsilateral hold, so I'm holding the dowel here in front of the stance leg, and that's a little bit more unstable. I've sometimes seen where people will hold it on the same side, but they move it off to the side, which kind of negates the challenge of keeping it in line with the hip. Okay, so that would be the progression to ultimately doing it hands-free. But I have here a kettlebell because ultimately I want to progress to where I'm using some form of resistance. So with the kettlebell, the next progression would be the ipsilateral hold, holding on the same side, and then the ultimate challenge would be the contralateral, where there's this tendency to pull me to the side opposite my stance leg, and in hinging forward, I really feel that in the corner of the glute, and that's where that glute medius is. I often cue clients to place their hand on that spot, the thumb right on that glute medius, and they can feel it activating underneath their thumb. So that's the single leg RDL. It's an exercise that I consider essential to any training program, regardless of skill level, and I'll be back to share more with you another time.